All right. How's everybody doing? Good? Awesome. Before I get started, actually, can I get a round of applause for our team? This whole event you see here is done by our amazing team. I'm up here talking, but I'm just presenting the amazing work they're doing behind the scenes. Everything that is great about this event is because of our team. Everything that is not is probably my bad, so I'm going to apologize for that. All right, so can we get the slides on? I'm going to tell you a few stories today, and I've promised our team that I'm going to run as fast as possible, so I'm not clogging the next sessions here and kind of running over in time. To start with, I want to talk a little bit about an industry that a lot of us actually use. Actually, some of you that have flown here from other cities have actually been flying here with some aviation industry services. Got on a plane yesterday, and yesterday and the day before, the flights were a little bumpy, so sorry to bring you in a kind of a springy weather, but the story is this. Around 40 years ago, in the aviation industry, almost everything, every task that was done to get someone from point A to point B via a flight was done manually. From everything that is happening on the ground to everything that is happening in the plane's cockpit. Actually, planes' cockpits look like this. A lot of kind of manual reading of different sensors, taking actions and making decisions based on that. Obviously, a lot of human errors in it. Expensive process to run through this. The problems were not the humans that were running the process. The problem was the process and the infrastructure that was enabling them to do this. Over the course of past 40 years, aviation industry has become 10 to 12 times more safe, and the cost of each flight has dropped by around 50%, right? Obviously, in this week, we're putting a Spirit airline aside. We're talking about some of the bigger kind of airlines in the industry. A core part of that is happening because the amount of automation that is baked into the whole process of getting you from point A to point B. From the co-pilots in the cockpit room for pilots to be able to fly a plane. In fact, fun fact, today in around 95% of flights, the pilot is only hands-on for an average of 9 minutes in every flight. So when you're sitting in a plane, not to scare you, software is running it, right? And your life is in hands of software. But guess what? It's actually working better. The process is working better. Again, it's not taking human out of the loop. Every time in the process you feel a little bit of a bump in the ride or in the landing and taking off, a human is taking a lot of the actions and making decisions. But software makes it safer and makes it cheaper. It also makes aviation a lot more accessible. It makes it 5x, since 1980s, we're flying 5x more times across the world. And this is not just US and Europe. Across the world, we're flying 5 times more, making airline services more accessible to people. And 2x more people, 2x more people are working in this industry. So I personally don't buy AI is taking away our jobs, right? This type of automation has happened in more complex systems before. I'm not talking about healthcare, across different industries. In the past, I would say 2 decades. Now, it's not all generative AI and stuff like that. The cool stuff you see with ChatGPT and Anthropic, or whatever kind of model you're probably using, that honestly knows way too much about us now at this point. But the automation made air travel safer, cheaper, more accessible, while employing a lot more people into it, improving quality of life for people. Second story. Let's move to healthcare industry. 1990s approximately, we started seeing some movements and changes in infrastructures with which we deliver care. We actually moved away from, let's put it this way, some of us moved away from pen and paper into spreadsheets to provide care to people. Offices still looked like this in 1990s. You still had a little bit of a desktop on the side, made the process a little bit more scalable, a little bit more data-driven. Human obviously was doing still most of the work, if not all of the work here. And system had a lot of inefficiencies. This era is called Software 1.0. It's not just healthcare specific. All industries went through this process. The problem, I think, with healthcare industry is that we still are stuck here for some of our operations. Now, some of the healthcare industry's operations moved into Software 2.0 era, where work looks like more this. You have electronic health record databases, you have CRMs and case management tools, and you have teams of care managers and operations and nurses and doctors sitting behind desktops, caring for people, and then using software as a process enhancer that helps them keep record of what they're providing, navigating the care better for the patient. The problem with Software 2.0 era is that care moved only at the pace of human. In fact, with Software 2.0, in some parts of the care navigation and delivery, we slowed down the process because we added more tools. I mean, in fact, you all probably hear or talk about this or hear about this depending on which of the stakeholders you're working in. It's like, we don't want more software on our desktops. Can you integrate in Epic? Can you integrate into our patient management, like case management system? Because we cannot have another monitor for our staff, right? This was the core problem with Software 2.0 era. Still is. And the limitation, it's our hypothesis at least, makes care more inaccessible, makes it more inhumane. If you're sitting there and your doctor is typing kind of clinical records, they're not paying attention to you. If you're sitting there and your case manager is just reading questions to screen you for food insecurity, that's not humane care. That's what we want to change. That's why at Blooming, we want to welcome you to Software 3.0 era. In this era, we believe that software, similar to the aviation industry, becomes the co-pilot for care management. It becomes a solution that proactively can engage patients, that makes care available 24/7, makes it more equitable for someone that is working 2 shifts a day, to still engage with a care manager in the evenings, in the weekend, to get access to some of the basic care they need. We believe that if we augment human with technology like AI, we can make actually care more humane. Now, what does this mean? In the older model, as I mentioned, the process is pretty much moving at a pace of how many staff you have. Are you screening enough people for different types of needs? If you're in social care, if you're in an emergency department, do you have enough nurses to engage with the patient, kind of read into their clinical records, understand the cause of them coming in, and so on and so forth? And then move them through the queue, through the patient journey to get the need addressed. Now imagine you could do threads of that care management in millions at the same time, considering even that you could even talk different languages that the patient might speak. You could reach the patient when they're off their job site. You could reach the patient when they have their documents ready, so they don't have to come back to you after they go and find their pay stub or proof of employment and so on and so forth. They're getting their help to stay covered with Medicaid. At Blooming, we're doing this at scale. And I'm going to show you a few examples of this to you today. We, in fact, are serving around 6.5 million people across 27 states. As a kind of a newcomer in the industry, we're still a startup. Serving 6.5 million people is something that didn't fit into our wildest dreams. But that's what technology enables us to do. We work with more than 2,000 programs and organizations across different communities in the nation. We work from your small neighborhood community-based organization that serves 200 people with case management, or a Meals on Wheels program, or a housing operation, or a large citywide food bank, to multi-state housing operations, to healthcare stakeholders, health plans and health systems, and government departments, all of which are having a skin in the game to serve people with their public health needs. One data point. In April, just this past month, we had around 2.7 million engagements with patients. For a company our size, which is like, I think, less than 70, 80 employees, what does that mean? It means if you're having 22 working days, that's around 130,000 patient engagements on average in a working day. If you're working 10 hours a day, that's around 13,000 engagements per hour. Some of you are in the business of healthcare, building care management teams, operating care management teams. You probably can estimate how many people you need to engage 13,000 patients every hour. What the cost would be, what the operation model would be, how complex it would be. But technology make it happen. We believe that the process is basically, the operational complexity is what's causing the problem for most of our industry, and that's what we're trying to solve for. Actually, all of the organizations actually we work with, they genuinely care about their patients. They want to help them. A lot of them have very suitable, workable models. It's just not scalable. It's not scalable, it's not financially viable to do at larger scales. And that's where we could basically help. Now, let me introduce you to a concept that I want to do a quick kind of a demo here. The concept is what we call as care enablement workflows. Care enablement workflows are a sequence of care journey events that takes a patient from the beginning of that journey and helps them throughout that process, getting them a primary care appointment, making sure they have the right to show up to that appointment. After that, making sure they picked up their prescription. If they need benefits or Medicaid continuity, making sure they're still enrolled in those benefits. That process is what we call care enablement workflow. The reason we call it care enablement workflow is every step of this process is removing a social risk as a blocker for that care outcome to happen. The process typically starts with a trigger point. The patient gets discharged. Our system reads that from an ADT database. Or there's an annual checkup due date coming on, or a Medicaid renewal due date coming on. We engage the patient. We can do that, again, in languages and communication channels across the board in a culturally sensitive way. We detect needs and we act on it in every step of the way in an automated process, and we generate the outcome and close the loop on it. This block, if you sequence this 50 times, it becomes a care enablement workflow, right? That's the complex kind of journey that could be hyper-personalized for each patient. We're going to show a few examples of this. The platform that we're going to show you is basically the orchestration layer that uses agentic AI to run this process, whether it's through a phone call, in between calls, collecting documents needed, making referrals to community-based organizations or to a primary care provider, following up about the quality of the service or whether that service has happened or not, and being able to kind of run that process end to end and escalate it to human when that bumpy patch happens. This is not taking human out of the loop. This is the co-pilot that makes the human to take a step back, not to work, but to work on the ones that are in their bumpy patches, right? That's why we call it the co-pilot. I want to introduce you to a patient. His name is Reza Karimi. He's a patient with multiple chronic condition, diabetes and hypertension, dual eligible patient covered by Medicaid and Medicare, and faces a couple of different barriers for access to care. And we're going to run a process here for you to show you how a system could basically work with someone like Reza, who is bilingual, speaks Farsi more than English, but can speak English as well, lives in California, how we could make Reza this one member to get to the outcome that we want to generate for him. For that to happen, we're going to shift the screen to the dashboard if possible. So introducing to you Reza's kind of, by the way, Reza is not a real person, so I can show you the records here, just to be clear. There's no breach of HIPAA. Reza worked with Green Shore Health, the provider in the Los Angeles, San Diego area. He has diabetes, as I mentioned, so he had a kidney health evaluation for his diabetes last month, and just recently made an emergency department visit due to hypertension, and we're going to start from the post-discharge. Before we get there, this dashboard basically is a simple kind of view into how a command center for a co-pilot would look like, showing you what's happening overall across the population over time, the engagement, the needs detected, the care gaps closed, showing it at the patient level, which kind of step every patient is throughout the process, and then escalating to care managers when there is a need to escalate to a care manager to intervene and help. So going back to Reza, our patient here, we're going to start with the ED discharge follow-up. So I'm going to get a call. Before we trigger the call, I'm going to actually get a real call. So God help me with a live demo with an agent on a real phone call. But before we get there, our system have ingested Reza's post-discharge instructions. It's basically using that post-discharge instruction to do a wellness check-in on symptoms, to check in on medication pickups, the checkpoints you see here. Schedule a PCP follow-up afterward, and you're going to see a kind of a passive social determinants of health screening happening throughout the conversation to remove any barriers he's facing. And the next action, as you see here, is that post-discharge check-in. I'm going to get a call on my cell phone here. Again, it's a real phone call. And I'm going to try to use this mic to both myself talk as Reza, and the agent will talk to me in my post-discharge call. So if you could go ahead and trigger the call. All right, I got the call here. Hello. Hello.
Hi, is this Reza? This is Blooming Health calling, your care partner. I see you were discharged yesterday after your hospitalization for blood pressure. I wanted to check in and see how you're settling in at home. How are you feeling?
I'm feeling okay, a little bit fatigued, but it's great to be back home.
That's normal. Recovery takes a few days. I'd like to go through a few quick things to set you up for the week ahead. Got a few minutes?
Yeah, absolutely.
Sure, we'll keep it straightforward. First, I want to walk through your discharge meds. The big change is the new one, losartan, for your blood pressure once a day. Our records show you picked it up at the pharmacy yesterday, which is great. Have you taken the first dose yet?
Yeah, I took one this morning.
Perfect. That's exactly what we want to see in the first 24 hours. Next thing on my list. Your discharge papers say you should follow up with your primary care doctor within 7 days. That's important for blood pressure recovery, so let's get that on the calendar right now. Let me pull up your doctor's schedule. Give me 1 second. Okay, I'm seeing a few openings. Wednesday at 2 p.m. or Friday at 10:30 in the morning. Which works better?
Friday morning works well. I need to tell you, after my hospital discharge, I've been having a hard time driving my car, but I'll try to find a way to get there.
Friday morning at 10:30 works great. We're able to book you a ride to your appointment completely free of charge through a service called Uber Health. Transportation should never be a barrier to getting you to care. Would that be okay?
Yeah, I would appreciate that.
Okay, Friday at 10:30 with your PCP is booked, and I'm booking the Uber Health ride now for 9:45 to give you a little buffer. Uber will pick you up at home, take you to the appointment, and bring you back. You'll get a confirmation text from the office and the driver's info closer to the day. Last thing on the medical side, I want to do a quick check-in on a few things outside the hospital that affect recovery. Hospital meals are one thing, but recovery diet matters even more, especially with blood pressure and diabetes. How's eating been at home? Are you generally able to get the kinds of foods you need? Fresh produce, low sodium, that kind of thing?
Unfortunately, I should say that I've been just eating whatever I would have been able to find around because I haven't been able to work much recently.
I appreciate you being honest with me. That's a common challenge, and it's something we can actually help with. There's a partner organization called Plate of Hope that delivers medically tailored meals, designed for blood pressure and diabetes, low sodium, balanced, and free to you through your plan. They deliver right to your home. I'd like to set that up so you have steady, recovery-friendly food while you're getting back on your feet.
Yeah, that would be great. I appreciate it.
I'll submit the referral today. They should reach out within 48 hours to set up your first delivery, and I'll follow up on our next call to make sure it's working out. Quick recap before we go. Your PCP is booked Friday at 10:30 with an Uber Health ride to get you there. Your new med is going well, and meals are on the way. I'll check back in a few weeks to see how you're doing. Take it easy, Reza.
Thank you. So this was the first call. A few things happened here. One, the system did a wellness check-in, just stuff that generally might need to be checked in post-ED discharge, like any symptoms. It did a medication pickup check-in to make sure patient picked up their medication and they're taking it. And again, in each of these steps, if that's not the case, the system would escalate it to the care team for them to intervene. Let's say if the symptoms didn't improve or for any reason the patient didn't pick up the prescription. It also did a primary care provider scheduling via API. We're going to do another scheduling system in a second. So a lot of healthcare providers might not have an API-based scheduling. It's a call center that you need to call to schedule. We're going to show that in a second. But what we're seeing here is basically two passive social drivers of health detection as a barrier for healthcare, right? A transportation ride. Fortunately, Reza has a health plan that pays for the ride via Uber and Lyft Health, so we could, via API call on the back end, book that ride. And then the second one was food insecurity, which we detected it and found a provider close by Reza and made that referral for him. In fact, the social needs resolution, one of them is confirmed because via API with Uber, but the other one is still open, and we're going to follow up on that to close the loop, to make sure Reza actually got the meal he needed. Now, this dashboard is what the care team sees. Every action that is taken, the conversation recording and summary, all of it is available to the care team. Even when there's no escalation, they could monitor how the system is working. Exactly like a pilot in the cockpit. Now, Reza has an upcoming diabetic retinal eye exam coming up. This is a part of the care journey. This exam is the annual checkup. So the system will need to call Reza to make sure that appointment is booked and then close the loop on a few items that is remaining from the ED discharge. The medication adherence check, making sure that appointment is booked, but also making sure we close the loop on the Plate of Hope referral, the food insecurity referral that is made. And you can see the next call is scheduled to happen. One thing I want to mention before we go to that call is that in this call, I, as Reza, I'm going to start talking first in Farsi with the agent. And midway, I'm going to switch it to English. And the system will adjust itself and continue in English. And then bring all that data back to the system in English for the care team to be able to monitor what's happening. With that being said, let's kick off the second call, please. So I got the call here. سلام.
سلام رضا، این بلومینگ هست، همکار مراقبت شما. حدود 4 هفته از زمانی که از بیمارستان به خانه برگشتید گذشته است. میخواهم امروز چند مورد را با شما بررسی کنم. اینکه داروی جدید چطور پیش میرود و چند مورد.
Sorry, I picked up on the thing in the background noise. Salam. Do you want to trigger off the call again? Salam.
سلام رضا، این بلومینگ هست، همکار مراقبت شما. حدود 4 هفته از زمانی که از بیمارستان به خانه برگشتید گذشته است. میخواهم امروز چند مورد را با شما بررسی کنم. اینکه داروی جدید چطور پیش می‌رود و چند موردی که میخواهم مطمئن شوم در تقویم قرار دارد.
Sorry, it's keeping. سلام.
سلام رضا، این بلومینگ هلت است، همکار مراقبت شما. حدود 4 هفته از زمانی که از بیمارستان به خانه برگشتید گذشته است. میخواهم امروز چند مورد را با شما بررسی کنم. اینکه داروی جدید چطور پیش میرود و چند موردی که میخواهم مطمئن شدم در تقویم قرار دارد. آیا الان وقت مناسبی است؟
بله، زمان خیلی خوبیه. ممنون.
خب، در مجموع از زمانی که به خانه برگشتید چطور احساس میکنید؟
خوبم، استراحت میکنم and I'm trying to get into a routine.
That makes sense. Routine after a hospitalization is a big part of recovery. Glad to hear you're settling back in. Before we go further, I want to check in on the new medication you started after the hospital, the losartan for your blood pressure. Our records show you picked it up at the pharmacy on time, which is great. How has it been going?
I've been taking it every day, every morning as prescribed. Now that you said it, just remembered that every time I stand up really fast, I feel a little dizzy in my head.
I'm sorry to hear that. Lightheadedness can happen with a new blood pressure medication, and it's something we want to take seriously. Can I ask, when you feel dizzy, would you say it's mild, like a slight head rush, or more severe, like you felt close to falling?
No, it's pretty mild. It's only happening when I stand up really fast.
Got it. That's helpful. I'm going to flag this to your clinical care team so they can review whether the dose needs adjusting. They'll give you a call back later today with their guidance. In the meantime, please take it slow when you stand up. And if it gets worse or you ever feel close to fainting, call 911 right away. I want to switch gears for a second. Looking at your record, you're due for your diabetic eye exam. That's the retinal exam where they take a picture of the back of your eye to make sure your diabetes isn't causing any damage. It's been over a year since your last one, and we want to stay ahead of it. Would you like me to get that scheduled for you right now?
Yeah, I actually keep forgetting about that. I would appreciate help with scheduling it.
Great. I'm going to dial in their office and bring you both onto the line together. You can work out the appointment directly with the receptionist. I'll step back and let you two handle it. Then come back once you're booked.
Sounds good. So it's calling right now the call center.
Eastside Associates, this is James. How can I help?
Hi, James. This is Reza Karimi. I'm a patient out there, and I got connected to you by the care coordinator at Blooming Health. I have an upcoming eye exam. I was wondering if you could help me to schedule it.
Hi, Reza. Yeah, happy to help. Give me a second. Let me pull up your chart. All right. It looks like we have an opening Tuesday, May 19th at 10:30 in the morning, or Thursday the 21st at 2 p.m. in the afternoon. Do either of those times work?
Yeah, Tuesday morning works perfect.
Perfect. So Tuesday, May 19th at 10:30 a.m., you're all booked. You should be getting a confirmation text from us and then a reminder the day before as well.
All right, thank you. I appreciate it.
Thanks, Reza.
All set, Reza. Tuesday, May 19th at 10:30 with Eastside Eye is on your record. Quick follow-up. Would you like me to book an Uber Health ride for that appointment?
No, it's fine. I'm going to go with my wife.
Understood. So, about the meals, have you been getting them from Plate of Hope? And are they working out for you?
Yeah, they've been coming in. The food is amazing. Really appreciate it.
That's great to hear. I'll close the referral as confirmed on our end so your care team has it documented. Reza, before we wrap up, I want to flag one more thing. Your Medicaid coverage is up for renewal in about a month. There's nothing to worry about, but the renewal does need to be submitted on time, and the paperwork can be a hassle if we let it sneak up on us.
Oh, I forgot about that. Thanks for the reminder.
Got it. Just to confirm, your Medicaid renewal is in about a month, and we want to make sure we submit it on time. Sure, no problem at all. I'll make a note that you're aware of the renewal timing. Now, I can help with that renewal process. I'll send you a secure link by text right after we hang up. It'll ask for a couple of documents, like your most recent pay stubs and proof of where you live. Then in a couple of weeks, I'll follow up with you. Does that sound okay?
Sounds great. I appreciate it.
Great. Thanks for confirming. I'll send that secure link right after we hang up. Once it's all set, I'll follow up in a couple of weeks. Sound good?
Sounds good. Looking forward to that conversation. Thank you. All right, I'm going to drop it here. So basically, this conversation focused on a few different things. One, booking that diabetic retinal eye exam. The call center was my colleague over there, so you heard a little bit of background noise. That was him talking to us, or to me. We detected a side effect from the medication. We, as a platform, don't provide clinical decisions. We actually run a highly deterministic AI solution, which follows the care coordination process that is fed into it to process. This means that we have an agent listening to every call, and as soon as there is a scenario that is not defined by the care operation that needs to be escalated to a human, it escalates it. And the side effect is one of those. So as soon as Reza talked about that side effect, this situation was escalated to the care team so they could basically call Reza and figure out if that side effect is significant for them to take any actions on. Besides the side effect management, we closed the loop on the Plate of Hope deliveries, and the system proactively detected that because Reza has an upcoming appointment and his Medicaid certification is coming due, he needs to go through that process so he can make that appointment. So the system would basically send Reza a link to upload his information. This is how it would look like, a secure link, so he could upload a pay stub and a proof of residency that not only helps the system to evaluate Reza's eligibility or continuous eligibility, but also pre-populates a lot of the information needed to fill out the form. Like in California, as an example, people like Reza could mail the form on their own to stay covered. So this would pre-populate that, pre-fill it, either provide it to Reza or to his the certified application counselor to submit on Reza's behalf. So now Reza uploaded that data, and the system automatically created the next step in the care enablement workflow here, which is the Medicare renewal call, which is the last call I promise you I'm going to get. This call is going to focus on making sure the documents are uploaded, going through a few questions. We're going to do a abridged version of the Medicare recertification form because we're not going to be able to spend the next 15 minutes here to fill out that form. But the system automatically on the back end fills out the form, sends a copy of that form to Reza to review and sign and via a text message, and then makes it ready for the certified application counselor to submit. So with that being said, I'm going to get another call now in a second that is going to run this Medicare recertification process. Hello.
Hi, Reza. This is Blooming Health calling, checking back in for your Medicaid renewal. Thanks for uploading those documents through the secure link earlier this month. How are you doing today?
I'm doing well, thanks. Thanks for sending that link.
Glad to hear it. I've got the form mostly pre-populated for more uploads, so this should be quick. We just need to confirm a few details and grab one signature at the end. Got a few minutes?
Yeah, absolutely. Let's do it.
Great. Thanks for taking my call. Before we jump in, if you're able to find a quiet spot, that would be really helpful so I can make sure I catch everything you say.
For sure.
Let's start with a couple of basics. The form has your address as 142 Walnut Avenue, San Diego 92103. That came from the utility bill you uploaded. Is that still where you live?
Yes, that's where I live.
Confirmed. And household. The form shows 2 people, you and your wife, Soraya. Is that still accurate? Anyone else living with you?
No, just the 2 of us.
Confirmed. Now, income. The most important section. From the pay stubs you uploaded, your employer is Pacific Coast Logistics, and your gross monthly income comes out to $3,420. Does that look right?
That looks right, yes.
Got it. And it sounds like that's been steady. Same employer, similar hours over the last 6 months?
Yes, all the same.
Confirmed. That keeps you well within the eligibility range for Medicaid in California. One more thing before the signature. I need to verify your social security number. The form has it on file from prior records, so I just need you to read me the last 4 digits to confirm.
Yeah, it's 5281.
Verified. Thanks. 2 quick yes/no attestations to wrap up the form. First, do you currently have any other health insurance coverage outside of Medicaid?
No, I'm just dual eligible. I have Medicaid and Medicare.
Confirmed. Second, any change in your disability status in the last 12 months?
No change. Same.
Confirmed. The form is now complete. All that's left is your signature. I'm sending you a signature request through DocuSign now. It should appear on your phone in a few seconds.
So I'm going to get a text here, or a text model here. The agent is still on the call, so it might talk a little bit, but it's coming from DocuSign. I can review the form as Reza Karimi, make sure the information is correct, and go and sign it, adopt and submit.
Looks like the DocuSign request should be coming through soon.
And this way, now that signed, attestation kind of verified form is uploaded into the system, ready for submittal to the state, to the local kind of stakeholders. Going back to the agent. Received and signed.
I see it on my end. Signature received and applied to the form. Perfect. With the signature, the form is complete. I'm bundling the form, your supporting documents, and the signature into a submission packet and routing it to a certified application counselor at your local Medicaid office. They'll do a final review and call you within 5 business days to confirm submission.
Awesome. Thank you so much. I'm going to actually drop it. So basically, I got a call as Reza Karimi. My Medicaid recertification was due. Because I was able to upload some of my information in advance, basically my pay stub as well as my proof of residency, the system had a conversation with me, filled out a form, ready to go and signed by me that could go to the certified application counselor here. We still have one step remaining here that we need to do a follow-up with Reza to make sure the form is actually submitted by the certified application counselor and making sure Reza gets the proof of submission from the state that he's going to get, is going to stay covered so he can show up to his eye exam that we saw above. This is basically what a care enablement flow is. A complex process, multi-stakeholder process that takes many steps to run. Imagine getting Reza on a call in one of these steps. Each one of these steps, it's going to take probably half an hour to an hour for a care team. Our system has 25 million member engagement, knows actually when is the best possible moment to call someone like Reza, so he responds, so that we can then remove some of these barriers that we're seeing here for access to care. Can we go back to the slide so we could wrap up quickly? All right, so you saw 3 care enablement workflows kind of stacked together: the care transition, post-discharge, the chronic disease control, and the benefit continuity. Benefit was predominantly obviously focused on Medicaid, but you could imagine the same thing happening with food stamps, with WIC, with other types of benefits. And what this process enables us to do is basically to do a high quality care flow at scale. You could do the same thing in tens, hundreds of thousands or millions of times. And that's basically where we think software can move the needle, where software could become the co-pilot to our care teams. I have 2 more things before I get off the stage. 1, I already talked a little bit about our AI governance structure, but the most important part to use AI in healthcare, in our opinion, is that the behavior of the system is predictable. If we can predict the behavior of the system, we can tell the system what to do. And if we can do that, then we could do high quality behaviors at scale. That's how our system is designed, and that's how our system is governed. In addition to the governance side, building responsible AI also brings our attention to the fact that we're going to create a lot of carbon footprint. So doing millions of these care enablement workflows is not going to come out of nothing. There's energy being burned. So just to set an example here, in honor of all of you coming in today, we've actually planted 1,000 trees for each one of you. So hopefully those trees are going to eat up some of the carbon footprint you'll generate with ChatGPT, Anthropic, and hopefully Blooming to get some of your tasks done better. The last thing I want to mention here is that we get inspired by ideas from across different industries. My whole conversation today was, hey, we're in the hands of software in some of the more vulnerable moments in our lives, and we don't even recognize it. And we can do that in the right way if we learn from different industries and then combine valuable ideas together. That's why I saw a talk by this gentleman called Bill Gurley. For some of you might know, he's an investor in Uber. He did a talk at University of Texas at Austin, talked about how the best of different industries, like music industry, like sports, have inspired folks in technology, in healthcare, to be at the top of their game, to love their craft, and to go the extra mile to make things happen that others might not have gone that far to make happen. To celebrate this inspiration with all of you, he actually wrote a book recently to celebrate this with all of you. Every one of you can leave today with a hard copy of his book, which is an amazing book. I've read it. Also watch his talk on YouTube. It's an amazing talk, I promise you, will inspire you. But when you leave out today, we have a couple of hundred of the copies there. It's going to be first come, first serve side. We don't know how many people are going to show up. But grab your copy. Hopefully you enjoy it and you get inspired. And let's keep this movement going. Thank you so much, and I appreciate you all.
What an incredible demo. It's another round of applause for Nima Roohi, please.